deltoid muscle with its innervation, the axillary nerve and axillary artery. Then we have on the back musculus supraspinatus, musculus infraspinatus, musculus teres minor, teres major, yes.
Where are they putting?
And then we have musculus subscapularis with its artery and its nerve.
Okay, how do you tell which one's the artery?
If you feel this can be squeezed, so
Okay.
a
That's a
liquid running through. The nerve it's thin and it's solid.
Okay, so arteries are the ones which can be squeezed.
Yes, but the veins are much softer than the arteries.
One is very soft and then one is, and nerves are hard to compress.
Yes.
Okay.
Then
What
we
about
have?
the teres minor and major? Their arteries and
No, here we cannot.
see it.
Yes.
Okay.
This is the subclavian muscle, varus musculus subclavian.
Okay.
Then we have
The
the
biceps.
biceps brachii with two
long-
heads.
Long head, lateral head.
This is
Shorter
the,
and longer.
This is the long head
That's
on
the
the
long head,
lateral
that's the
side. And remember, the long head is between the two tubercles, tubercle minus and tubercle majus, in the intertubercular groove.
Of the humerus, yes.
And it's on the lateral side,
Yes.
on the radial side. This is normal anatomical position. So always on the lateral side is the long head. On the medial side is the short head. This is the short head of the biceps. Which nerve innervates them?
The bicep is by the brachialis. No,
Musculocutaneous.
musculocutaneous.
Nervus musculus cutaneus. This is the nerve. Actually, this nerve innervates all the three muscles here in the anterior compartment. Remember them as the BBC. Biceps brachii, brachialis, coracobrachialis. Under the biceps brachii is musculus brachialis. This is musculus brachialis. And this is musculus coracobrachialis. All innervated by the musculocutaneous nerve. You see, goes into the biceps, goes into the coracobrachialis, goes into the brachialis. Posterior compartment. We have only the triceps. The triceps is innervated, but by the radial nerve. The radial nerve is one of the terminal branches of the brachial plexus and goes into sulcus nervi brachialis. If you touch here, you can see a groove. This is the radial groove, and the nerve travels behind the humerus and goes here on the radial side, continuing on the radial side of the forearm. So anteriorly we have part of arteria axillaris, which travels downwards, and it's now arteria brachialis, the main artery of the yes.
Then it breaks
Arteria brachialis. Arteria brachialis travel and
radial and ulnar.
to actually this is the brachial artery. It's broken. Yes. Let's orientate it.
Yeah, there.
That's ulnar and that's radial. ये मेरा नहीं है उसमें माम का
So it's something like this.
वीडियो अगर अच्छा
Yes,
बन जाए,
it's
फिर
like
सब
this.
देख के practice.
So this is part of the arteria axillaris, then goes into the brachial artery. The brachial artery bifurcates into the cubital fossa into main
Radial and
arteria radialis and
the
arteria ulnaris into the cubital fossa.
the triangle thing here. Okay.
So actually, this is the artery, this is the vein. So
They're like
now let's differentiate them. The vein is like a flat tire.
yeah,
The artery is
Little
more
tougher.
rigid.
yeah.
Okay.
You see?
Yeah.
Yeah. So both the vein and the artery, here the artery bifurcates into the this is artery. And if you
This is the vein.
just try to squeeze that, this is a vein. It's like a flat tire. The artery is more stiff, it's more rigid. Yes.
Your hijab is touching.
So the brachial artery bifurcates into
Radial and ulnar.
radial and ulnar.
Okay.
Okay.
And where are the cephalic and basilic veins? They're like very big.
They're superficial
Yeah.
and here not present.
Oh.
Okay.
They're here under the skin.
Yeah, that's what I'm wondering. They're like big.
Which is on which side?
Cephalic goes from here, the lateral side.
Yes, remember B in the alphabet is before C. So basilic is medial, cephalic,
Cephalic is
left.
lateral and
Because
here.
C is later in the
Yeah,
alphabet.
and they all dump into the axillary one. Yeah.
Yeah. All drain into the axillary vein.
Okay.
Okay. So now muscles. Here is gets.
This is now the medial
Abductor.
superficial layer.
So this is part of the ulnar
Ulnar, yeah.
artery. Do you remember how many arches do we have here?
No, two. I think
Two arches.
one break.
You have a question. What is the blood supply of the hand?
Good.
It is
It's
supplied
It's
by
2.5 and 3. 3.5.
No, this is about the nerve innervation. So,
median.
when you have blood supply of the hand, you have to tell that we have three main arteries here supplying with blood the hand and the fingers. They are the ulnar one, the radial one, and arteria. No, we don't have median artery. We have arteria interossea. We have median nerve, but we don't have median.
Yeah, the
artery.
posterior
Pretty common mistake. So the ulnar artery give branch. This branch is called arteria interossea, from its name, in between
The
the
bones.
bones.
Interossea.
This is part of arteria interossea. Sorry.
Which one?
This.
Anterior or
Here
posterior?
it's what?
Anterior or posterior?
In between, deeply in between the bones. This is the radius, this is the ulna. In between, we have membrana interossea. If you have pin here,
Okay.
this is membrana interossea.
Okay.
Anteriorly, it's running arteria interossea, which is from the ulnar artery, a branch of the ulnar artery. So these three arteries, main arteries, supply the hand: ulnar, interossea, radial. Radial and ulnar artery travels distally to the hand, and here we have a network I said it previously.
Distribute. Left.
Arches. We have two arches. Yes.
Yes.
Superficial arch and deep arch. The superficial arch consists of 2/3 of the ulnar artery and 1/3 of the radial artery. The deep arch is the opposite: 2/3 from the radial artery and 1/3 from the ulnar artery. The superficial arch gives each of the fingers two arteries. So each finger has two arteries, radial
Each the
and
radial
ulnar.
and the
one.
ulnar, they give two to each finger.
Yes. So the superficial arch is more important, and we have this kind of question: which artery is more important, the ulnar or the radial one?
They're both equally important.
Ulnar.
The ulnar is more important because the superficial arch give about 70% of the blood supply to the hand, and the superficial arch, 2/3 of it, it's covered by the ulnar artery. So the radial, we can cut it, and we don't have problem with that. So two arches, superficial and deep. The superficial arch give the arteries to the fingers. Do you see? They're pretty small.
Can we not see like the veins with them because the ulnar and
No, the veins are more superficial, and then they cannot be
they're
seen.
paired, right?
Yes, they're paired. So let's see here the muscles.
Okay.
This is okay.
Brachioradialis. That's the.
So brachioradialis is this muscle.
That's big and fat. Yeah.
Yes, muscus brachioradialis. Actually,
What?
this is muscus brachioradialis because it inserts here near the
Starts
skin,
from here to here.
and it's from the brachioradialis. Then what we have?
Where is the pronator teres and all that stuff?
This is part of pronator teres.
So it's like cut off.
Where is the other pronator? Here,
Pronator
the
quadratus.
pronator quadratus. So if the pin is here, it's pronator quadratus. If the pin is here in the
It's
membrane,
the
membrana interosseous. Yeah, in between the bones. What we can see.
The flexors.
These are the flexor.
Flexor digitorum.
Flexor digitorum superficialis. Flexor digitorum superficialis. How we can differentiate them? The superficial flexor inserts into the middle phalange of each of the fingers, like a V with two bands. You see, like a V.
It's from this.
Yes, it's and with the superficial we can do flexion in the proximal interphalangeal joint. So with superficial we do this. To have flexion in the distal interphalangeal joint, we have the deep flexor. The deep flexor, it's this. Flexor digitorum profundus. The deep flexor goes into and
goes in
inserts
between the
into
V.
Yes, like
Flexor
this.
digitorum
So the
profundus
V
is inside the V.
Yeah.
what?
The flexor digitorum profundus is
Is
inside the
this?
V for the
Yes,
upper distal
only
flexion.
one tendon and travels under the V, under the superficial flexor, and inserts into each of the finger distal phalange to do flexion in the distal interphalangeal joint. So we have deep, to do this, we need deep flexor.
Okay.
To do this, we have superficial one.
Okay.
Then, what is this?
This is
When we have
Palmar.
on the colloquium or the exam, when you have pin, try to touch it to pull it a
Flexor
little
radialis.
to see. That's helped a lot. So we can see this. This is a flexor, right? And inserts into the carpal. And do
flexor carpi radialis.
yes, exactly, because do flexion on the carpus, in the carpal joint. This is flexor carpi radialis. Then we have
Flexor
flexor carpi ulnaris. What else?
यहाँ पे एक और भी मसल था
The flat one here.
Palmaris.
नहीं यहाँ पे
Yeah, this one flat like this.
and we don't do we need he talked about the profundus, the V and the one the one which goes in between is the profundus.
It's
Pronator.
We talked about it is like torn.
It's torn.
Yeah,
Pronator teres.
it goes inside here.
Pronator quadratus.
It attaches on the just
It
Then we
attaches
have
1/3 of the
This
This one is the profundus, the middle
The,
phalange one.
the inside
this
this,
is the
between
profundus.
the V.
there is a V. Look, you see the V? Like each finger is like, it has like 3.
Yeah.
And the,
Yes.
this one is like the,
The middle one is
superficial
the.
one, and
Yes.
the middle one is the
The
profundus.
profundus goes under the V. For easy explanation, you will not tell this on the exam. You will tell that we have two flexors, one superficial, which insert into the middle phalange and do flexion in the
Proximal region.
proximal interphalangeal joint, and then we have deep flexors that inserts into the distal phalange and do flexion in the distal interphalangeal joint. That's the academic for the exam. But to remember it, we have V. The V is superficial, and
That's the profundus.
the profundus go underneath.
Okay.
Just to catch it.
And the
Okay.
deep part of the
इधर एक और मसल तो सुपर
So वो पीछे है वो super supinator.
So this is
इसका
This is, we have another small flexor here for the digiti minimi. Flexor digiti minimi. Do you see it? Yes. Digiti minimi.
Flexor pollicis longus.
Yes, exactly. This is flexor pollicis longus.
Where is the breath?
Here,
Yeah.
into the tenor muscle. We don't have palmaris here to show you. I will show you.
Do you, can we see the thing? The
What is this? What is this?
This is narrow.
Is it a nerve?
No, artery.
Is it a nerve?
Yeah, this
Of
is
course, it's a nerve.
See that?
Which nerve? Which nerve? Which nerve travels in the middle? The median nerve. This is the median nerve. Travel
and it provides
directly
everything here.
into the central lane here, and going into the carpal tunnel. Which structure passes through the carpal tunnel? The median nerve. What else?
Radius, no?
No.
That's artery.
There's the flexor.
Muscle. Superficial flexors. Four of them. With the nerve, 5. What else?
There's one more thing.
The deep flexors also. So we have 4 superficial flexors, 4 deep flexors, 8 with the nerve 9, and we have 1 more. What else?
There should be some vein. That's a flexor.
No. It's good.
the pronator pollex.
It's good. Yeah, not pronator. Flexor pollicis longus also travel through the carpal tunnel.
This is,
So
this flexor
we have 10 structures going through the carpal tunnel. And this is, you can see the, yeah, actually it's this.
Isn't this the flexor
Yes,
pollicis longus?
it's like this. This is the deep,
This is the deep flexor.
the deep flexors that pass under the deep. Now on the extensor side. Here we don't have superficial and deep extensor. We only have one extensor digitorum. Extensor digitorum. And here they have extensor apparat or extensor hood that inserts into proximal and distal phalange. So we have 2 flexors, superficial and deep one, but only one extensors. So extensor digitorum. Oh, do you know what is this? It's the palmaris. Yes, this is the palmaris. This is the palmaris. It's the most superficial muscle with thin tendinous part and like a flat into the palmar fascia. It's the most superficial muscle. Palmaris musculus, palmaris longus.
caput transversum obliquum is asked about caput
That is the policies. That a hand mungala forearm cow.
This is
Okay.
No, he got it. We'll do hand afterwards.
is your knee
That's it.
So this is extensor digitorum.
This is
What
the
is this?
extensor ulnaris.
Extensor carpi ulnaris.
Extensor carpi.
Extensor carpi ulnaris.
you just
Is the extensor indicis. The bottom.
Yes, this is
Extensor indicis.
extensor indicis. And then we have extensor digiti minimi.
Digiti minimi.
So extensor digiti minimi, extensor indicis.
Then
Then we have extensor
pollicis
longus.
Longus
and brevis is deep in.
Extensor pollicis brevis, abductor pollicis longus. This is the abductor. Abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus.
Longus, brevis, and then abductor is where?
Abductor pollicis longus.
Oh, it's all coming from the same thing.
Yeah, but here is not good. This is another muscle. In this,
Yeah, it's supposed to
I
be
have to-
separate. Yeah,
yes.
when I
Yes.
saw in the atlas thing. And then extensor radialis.
So-
where is that?
extensor pollicis
Pollicis
longus,
longus
extensor pollicis
Brevis.
brevis, abductor pollicis longus. The small abductor is here in the tenor
That is
region.
that transfer.
For the exam and for the colloquium, we don't pin here the tenor muscles. Very, very rare. Very unlikely to someone to put here a pin. Just to know that.
And where is the extensor radialis?
Extensor carpi radialis.
We didn't talk about that yet.
It's this.
We didn't talk about it. This.
Do you see? Extensor carpi radialis, and here is extensor carpi ulnaris.
Yeah.
But we have two extensor carpi radialis longus
And then
extensor carpi radialis brevis.
Yeah, brevis.
brevis is this one.
Yes, that one.
this one's the brevis
Yes,
and the longus.
and extensor carpi radialis brevis and extensor carpi radialis longus.
That is
We
anconius.
have two carpal extensors, one carpal flexor.
Do we need to know about the anconius
Anconeus is here.
The back one? Yeah.
and the supinator?
Anconeus is here. The supinator, actually,
We didn't talk about it.
it's a small muscle here. Here is the supinator. You see, when you see a muscle pinned here, you can think for a second to see, oh, this is the biceps. The biceps, two heads combining into one tendon and inserting into the tuberositas radii near the radial head. So
Gap like this is the radius.
the roof of the insertion is actually the supinator canal. Here is the supinator canal. So if you have structure pin here, it's probably the supinator. It's a small
So
muscle.
like this.
It helps in
Yes,
supination.
yes. Supinator canal
And where is the anconius? We didn't see it.
here in the lateral side.
It's like
It's a small. It's part. It's part of.
it's
Here.
like under the elbow. like
Yes,
almost.
it's this.
वो जो triceps
छोटा
के
सा.
साथ
हाँ, वो छोटा सा.
Supination was supposed to be like this.
Supination holding the soup.
Yeah,
Pronation
throwing this.
pissing the soup out or throwing the soup.
Yeah, like that.
So supination soup. Hold the soup. Pronation. What is abduction? Adduction?
Adduct, abduct.
Abduct.
Abduct and adduct.
No,
Away
this
from
is
the body.
flexion.
No, this is flexion extension, but
This is easy.
it is this abduction.
Abduction.
Yeah, sorry.
Adduction.
Add and then abduct.
Add.
Add
ABD.
Yeah, add and then IABD. Yeah. Add is like you add it closer to.
Flexion, extension. What is internal? What is external rotation?
Rotation?
Rotation.
External is internal or external?
With the leg, for example.
This is
external.
external.
This is internal.
Yeah, so abduction away from the.
Or this internal rotation is also called medial rotation. External rotation is also called lateral rotation. And pretty much that's it.
So what about circumflex artery? Can we?
Circumflex on the. I'm not sure we can. I'm not sure we can see exactly what this is. Do you know what is this?
This is the terrace major.
Pectoralis.
Pectoralis.
Sorry, pectoralis major. Sorry.
Teres to
No, I meant pectoralis, but I said wrong.
This is part of the brachial plexus. Here we have, but it's pretty spaghetti here. You cannot.
Do we not bother much with the hand? Like the muscles in the hand?
What?
Do we not bother much with the muscles in the hand?
No.
Enteroceasis and all that stuff.
No, we have. Here is the tenor.
But you
Tenor
said
muscles.
that's like unlikely.
Unlikely. This is the abductor brevis. We have. This is the opponent.
नीचे सबसे नीचे वाला opponent
Yes.
होता है.
We have adductor here, but it's not the second. Yes.
So this one's not the abductor.
This is the abductor. And here we have the opponents. Yes. This is part of the adductor, but
Could you show over here?
deeply actually we can see the part of the deep arch here. Part of the deep arch, but it's not dissected. This is part of the deep arch. And here we have interossei, musculus interoseus. In between the metacarpal bones.
And what about the
transverse.
So can I show the object more like over here?
What else?
Can we see the trapezius here?
No, the trap is not here.
trap is like here?
Okay.
Also, the anything about the mini end is
What is the another important thing? What is the innervation? The sensory innervation of the hand. So which nerve innervates the hand?
The hand is the medial,
Radial,
medial, ulnar,
annulus, radialis,
medial, ulnar, and radial.
or
Median, radial, ulnar. So if we divide the hand on two sides, palmar side and dorsal. On the palmar side, 3 fingers and a half from the first. This is the first. The thumb is always the first. The pinky is the fifth. From first 3 fingers and a half from the palmar side is the median. Median. Because logically the median travels here and
it's
give
like up top here. So
Sida.
other,
I think that's the
It's the
ulnar.
One and a half.
yes, finger and a half from the fourth is the ulnar.
Back everything is radial.
On the
No, this
on the back,
median. These
the ulnar also give finger and a half.
Okay, now.
Ulnar. So the ulnar innervates like this on both sides. But on the back, the first 3 fingers and a half is from the radial. So radial, ulnar, medial.
wasn't it like the
So what about the median?
Yes, this is more difficult.
Median is only front.
But for simplicity, know this. If you say like this on the colloquium and on the exam, it's okay. Actually, the things are much more
in detail.
in detail.
There was one about the tip and the.
Yeah, he said it's
Yes,
okay.
this is called autonomic zone. So actually, the median nerve
like here.
gives not only here on the palmar side, but
here. and
Tips on the
also
back side.
The
yes.
dorsal side of the distal
Yes.
phalange is also
by
by the median.
Uh-huh.
But for simplicity and for second year medical students, you know that on the dorsal side is radial, here is median. The anatomy can be much more in detail, but not. That's why you have, if you see on your books, for example, Gray's Anatomy, it's written for students.
Yeah.
There is another Gray's
Gray's
Anatomy,
Anatomy,
which is
which is
5,000 pages,
Yeah.
and it's much more in detail, and it's for surgeons, for doing anatomy stuff and so on. That's why it's for students. Yes.
Do you think we missed anything? Arteries, veins.
I think that's pretty much
Veins
for the
only we saw one.
Could you show axillaris again? Axillary nerve.
axillary nerve here. Axillary.
This is axillary.
Yeah, it actually like travels like this.
It rotates around the
And
head of the
when
humerus.
we
The
we
anatomy
doing
looks
surgery on the humerus, when we have broken humerus, we go
cut
with the
down.
incision like this. We split the muscle here in the raphe, and we try the nerve and the artery are on the bone like this. Pretty usually, the fracture is here in the surgical neck, and we try to preserve this
And
because this give innervation
To the
to
dead.
this
Yes.
muscle. If we damage this, the patient will not be able
Narcosis.
to
Lose the
No,
function.
he will have function because we have another nurse, but it will be numb here.
Okay. Sensory feeling
here, right? Axillary and radial, right?
No, the radial is
Radial
here.
at the back.
Oh,
It's on the back. It's only the axillary nerve with the vein and with the artery.
so it goes to the triceps, the backside.
Yes,
Radial.
the radial,
Actually, ऐसे घूम के फिर वापस आ
which
जाता
are the 5 terminal branches of the brachial plexus.
Musculocutaneous,
Radial.
radius, median, median, ulnar.
Yes, marmot, musculocutaneous, axillary, radial, ulnar, median.
Okay, yeah. बंद कर दे भाई.
We don't need to know